we'll just move ahead to our scanning spree. May we get the model and the faculty ready? So we have 4 faculties we have Dr. Mafizzeral Mamat here, my former colleague. That requires no introduction. We have Dr. Afifi Ahmad, our pain guru there. I'd like to introduce 2 more faculty for this session. Dr. Lim Siew Min, who's a lecturer in UMMC, has completed fellowship pain fellowship in Toronto. Dr. Iskandar Khalid, who's a lecturer in UKM, who's going to do the pain fellowship in Toronto sometimes later this year. So may we get ready. So I think, who's the model? Model is coming. So, okay, the whole idea is going to be interactive. So you guys can ask them to scan anything and ask questions. Okay? So maybe I ask Dr. Iskandar to do the first scanning. And we will have also Prof Karmakar to demonstrate to us what he talked at a probably later stage.
Okay, I think everyone can hear me, right? So we're just going to show the basic blocks we already saw just now. So the left side of the screen is lateral, the right side of the screen is medial. I'm just going to start from the supraclavicular region. So here you go. Do we have a marker, a pointer? Maybe.
Sure, I'll show for you.
Yeah. Okay.
I think Jean can show this cursor. Yeah.
Yeah. So, yeah, that's the supraclavicular brachial plexus. And can we do a Doppler scan? There's a vessel right in the center there. Yeah. Okay. So we want to move on to the interscalene. As we showed earlier, just slide the probe up the neck. And you can see there the anterior medial scalene muscles. And this is where you're going to do the interscalene nerve block. And I think Dr. Kyril showed just now the superior trunk block. So let's just trace superior trunk. On the right side is a medial. Yeah, that's the superior trunk. And I think Dr. Shah was asking about the shoulder, the phrenic nerve sparing nerve block. So what we're going to look for is the suprascapular nerve coming off the superior trunk. So it's an artery there, right? Transverse cervical. And you can see what we're going to look for is one of the nerves moving. You see the nerve moving laterally under the omohyoid. About there. Yeah. That's the suprascapular nerve moving outwards. Okay, is there any blocks anyone wants to see in the upper lip?
Any requests?
Request?
Can you show the Doppler of the vertebral artery?
Vertebral artery.
Doppler of the vertebral artery. You got
vertebral artery. Okay. Need to go deeper. Can we go? Yeah. Having a bit of difficulty. Maybe I can ask Dr. Aziz to come help me here. Boleh. Oh, okay. There you go.
Okay, that's vertebral artery. Yeah. Okay, anyone else?
Anyone else want to see anything in particular? I mean, we can.
How about C7 just next to it?
So let's look for. Costoclavicular.
Costoclavicular.
Someone say
Costoclavicular.
costoclavicular.
Okay.
Okay. So costoclavicular right down here under the clavicle. Again, the same. Left is lateral, right is medial.
I think, yeah, for a better image, probably that would be the best. Yeah, because the LED screen.
Just have a look at the LED screen. On your right hand side, you would probably see better.
Yeah. I think need to increase the depth, boleh? Okay, wait, let's just start from the infra. Okay, so costoclavicular. Maybe the bantal ni boleh adjust ke bawah. Yeah, there you go. And then you can use abang tak tangan belakang. This one. Okay.
Yes.
So this position is always important when you're trying to scan below the clavicle. Yeah. So there you go. Yeah. Okay.
The one who described
Okay,
costoclavicular.
Prof Manoj, come. Maybe you want to help us out here. Yeah.
I can see that the gentleman is struggling a little bit. Now, actually, if you look at any paper, the authors describe everything, but actually the secret is between the lines. Now, if you don't read carefully, you will not find the secret. So because I'm here today, I can reveal it to you. Don't tell anybody this one. Now, the important thing is, when you do a costoclavicular scan, the arm must be abducted. The moment you hyperabduct it, okay, you will distort the anatomy and it becomes more difficult. So, my advice to you is, just put it on an arm board, palm facing the ceiling, and you will get it. Because this has to elevate the lateral edge of the clavicle to expose the undersurface anatomy, okay? Now, if you hyperextend it, it stretches the muscles and the thing, and it becomes difficult. I often see some places I have been, I've seen they are doing costoclavicular with the arm abducted. Means they haven't read between the lines, you know what I mean? So, I will hopefully try and show you that there is some subtle differences in the anatomy, and the objective of costoclavicular block is that so that you can objectively identify the three chords. You may be God, but you can't really see the three chords when you do a lateral sagittal infraclavicular block. So this is why we describe the costoclavicular, so that you can see the three chords. So let me see if we can try and overcome this difficulty here. Thank you. Can you just put your arm like that? Also, I think if you are performing the scan or the block, if you're a right-handed individual, I would usually stand on the top, because then it allows you to use your right hand, okay? If you're right-handed individual doing a left block, then put the machine here, you stand over there. But the position of the arm will be like so. Can I have some gel, please? The transducer is a high-frequency linear transducer. These are usually broadband transducers. So to your left on the screen, which says M, is going to be lateral. And so that's going to be lateral, and that's the other side will be the medial, obviously. Now, with anything in life, there has to be a sequence, okay? Think about it, it's very true. Whether you look at it personal life, whether you look at academic life, there has to be a sequence. So, with respect to any scan, let's say we are going to start in a sequential manner. Now, I just want to optimize the image a little bit. See, the focus is not in the right place. Can you move the focus up, please? Yes, thank you. Reduce the depth. Can you put it on virtual convex? Okay, see, we did a little magic here. Now, we've created a virtual convex with a linear probe, because this gives you a much wider field of view and it gets to see the image better. Now, I'm going to put it on the clavicle. So this is the first secret to you. Now, you see here, if you look at the transducer, it is on top of the clavicle. It's a bony surface. There is dark side of the moon. So you're going to see nothing. Okay, but this is a good starting point. Now, watch what happens when I slide it underneath it. Can you see? You can see there's a muscle mass there. To your right, you can see the axillary artery, which is pulsatile. The vein is medial to it. I'm not even looking at for the nerves, okay? I'm trying to identify the adjacent anatomy. The next thing is I need to identify the subclavius muscle, which is the muscle anterior. So you have the pec major, which is that large muscle over there. The subclavius muscle in this young man is a little bit more difficult to identify, but it's usually seen as a long, thick strand muscle. Just a little bit up, please. Yeah, that would be where the subclavius muscle is. And then if you look lateral to the artery, you can see a hyperechoic bunch of things there. Can you see there are 3 hyperechoic structures? This is the medial cord. One to the left here. This is the posterior cord. And the one on the top is the lateral cord. So this is an arrangement. Can you freeze that for me? This is an arrangement that is very consistent across patients, very consistent from person to person. But if you look at it more critically, actually there are 2-story building. Okay, there's a fascial layer, there's a septum where the lateral cord is imagine it's on the upper floor. And the posterior and the middle cord are on the lower floor. Now, it doesn't really matter from an injection point of view because we are performing the injection at the center of the nerve cluster, okay? So we will direct our needle somewhere over there and place our needle with hydrodissection and perform the injection. So, 2 lessons for you. Be systematic. Use the bone as your friend. So from here, the clavicle will be a good starting point. Then just slide it. Positioning is very important. If you have the arm inappropriately positioned, then you will have difficulty because it alters the anatomy. Otherwise, it's quite a simple scan.
Thank you so much, Prof.